A very good day to Professor Dr. Zainab. Today I'll be presenting on the synthesis and antimicrobial activities of multi-substituted thiourea derivatives. Up to this day, there has been cases of antimicrobial resistance due to traveling abroad, poor hygiene, and manures from non-metabolized antibiotics. This research is prior to use existing substitutes onto the drug candidate before being evaluated using spectrometers and the microorganisms chosen. Researchers have faced many challenges when it comes to studying thiourea derivatives. One of them is its modification could lead to steric hindrance, conformational changes, and unstable complexes, which could bring side effects onto the patient. Another would be diseases are more resistant towards the current medicines, and the new mechanism of the synthesis has not been studied truly. The objective of these studies are to synthesize aspirin with 3-triofluoromethylenedione derivatives, to evaluate the functional group using Fourier transform infrared hydrogen-1 carbon-13 nuclear magnetic resonance, and to evaluate its inhibitory activity using gram-negative and gram-positive bacteria strain. What can we hypothesize from this study? Using hydrogen donors for anion binding will stabilize the molecule. Using molecular docking will discover the highest possible bindings for the derivatives, and the antimicrobial activities of the synthesized thiourea derivative will exhibit persistence against the microorganisms chosen. Moving on to literature review. Anion binding. There has been a discovery of amine and hydroxide groups used as hydrogen donors to stabilize supramoleculars. This can be used for thiourea derivatives and aspirin to restrict conformational freedom, so that there will be no side effects onto the patient. Next is molecular docking. Molecular docking often comes hand in hand with in silico techniques to find the highest possible binding sites, binding affinity, and conformational of dock ligands. This molecular docking can be used with aspirin and also the multi-substitute derivatives. Next is microbial activities. Researchers has highlighted several types of thiourea derivatives and systemized them through several applications using bacteria strains. Next is the materials and method. First, the aspirin with oxalyl chloride will be mixed in dichloromethane and few drops of tetrahydrofluorine before they will be stirred. This mixture will then be filtered, added with the mentioned derivative before precipitating it. The residue will then be recrystallized in ethanol. The recrystallized ethanol will then be evaluated using Fourier transform infrared, hydrogen-1, and carbon-13 nuclear magnetic resonance spectrometers. There will be two references to view on this substance. Next is the bacterial activities. There will be 4 bacterial strains used to evaluate the synthesized derivatives. The inhibitory activities will be evaluated at 5 different concentrations from the residue. Now is docking. Structures of thiourea and aspirin will be obtained at ChemDraw Ultra 12.0. The structure's alignment and hydrogen bond interaction will be obtained by using Autodock tools and 2 of its program. Affinity map in grid spacing will be in 0.375 angstrom. From these expected outcomes, the study will lead to a new discovery of synthesizing an efficient thiourea derivative with greater yield, display excellent inhibitory activities based on its ionic binding and also the substituents used. By that, this research would focus by increasing the concentration of aspirin with 3-triofluoromethylenedione derivatives. This is my work plan based on this Gantt chart from studying from this year of January up to next year of January. Thank you for listening.